Hi, it's Jane, and on today's Healthier You, we're going to talk about hearing loss. This is a common problem for a lot of older folks, but it's not only older folks. I have a friend who is, I think she's going on 41 years old, and she has severe hearing loss as well. So, these are some signs and symptoms, some things that you can do if you find that you are having hearing loss. So, let's start with the medical disclaimer. Always check with your physician before starting any exercise, dietary program, or using my advice. Information here is my personal research into different health topics and is not to be considered medical advice. Hearing loss is a pretty common problem caused by loud noise, aging, disease, and genetic variations. Now, this is what's scary. About 1/3 of older adults have hearing loss, and the chance of developing that increases with age. People who have hearing loss may find it difficult to have conversation with friends. They may also have trouble understanding even doctor's advice, responding to warnings, and hearing doorbells and alarms. And here's the biggest thing. There's going to be a lot of people that do not want to admit that they are having hearing issues and having trouble to hear. So they often will ignore those and they're untreated and it just gets worse. So if you have a hearing problem, see your doctor. There are hearing aids, special training, certain medications and surgery that can help. So some of the signs of hearing loss, and this may be because you may not even realize it, that you should see your doctor. Have trouble understanding what people are saying over the telephone. And I'm not just talking about those calls we get from people in other country, spam calls, or when you call, about a bill and you get somebody in India. I'm talking about just understanding someone you would normally talk to on a daily basis or even a weekly basis that you're having trouble understanding them. Finding it hard to follow conversations when two or more people are talking. You often are asking people to repeat what they said. You need to turn the TV up louder, so much louder that other people are complaining about how loud it is. Have problem understanding speech because of some of the background noise around you. Think that others are mumbling. Can't understand what's being said when children and people with high-pitched voices speak to you. That is usually the most reason for hearing loss is because of the high pitch. We lose that first. Now, there are some people that are born with not being able to tolerate that high pitchedness. My husband was one of them, and he had his testing done as a kid many times. They determined he doesn't have a hearing loss. It's just there is a pitch that he does not hear that is a defect in his hearing canal. He learned how to compensate for that and to be able to understand what's going on. So there are techniques and things you can use to learn some of those things. Hearing loss comes in many forms. It can range from mild, to which you miss certain high-pitched sounds, to a total loss of hearing. Sudden hearing loss, sudden deafness, is also known as sudden sensorineural hearing loss, is an unexplained rapid loss of hearing. Can happen to a person all at once or over a period of few days. That is a medical emergency. If you or someone you know experiences sudden hearing loss, see a doctor immediately. Age-related hearing loss, also called Presbycusis comes on gradually as we get older, seems to run in families and may occur because of changes in the inner ear and auditory nerve, which relays signals from the ear to the brain. Presbycusis makes it hard for a person to tolerate loud sounds or to understand what others are saying. Age-related hearing loss occurs in both ears, affecting them equally. Because the loss is gradual, people with this may not realize they have lost some of their ability to hear. Now, let's not confuse that with thyroid issues, because if you have hypothyroidism, many times you cannot tolerate loud sounds. So that is something that's a little different there, okay? Tinnitus is also common in older people. It's typically described as ringing in the ears, but can also sound like roaring, clicking, hissing, or buzzing. It can come and go. It can be heard in one or both ears, may be loud or soft. Tinnitus is sometimes the first sign of hearing loss in older adults. It can accompany any type of hearing loss. It is a symptom, not a disease. Something as simple as a piece of earwax blocking the ear canal can cause tinnitus. It can also be a sign of other health issues, such as high blood pressure or allergies. Tinnitus can also occur as a side effect of certain medications. I have tinnitus all the time, and we do know that most of it is related to my allergies. When my allergies are the most active, then I hear that ringing in both ears all the time. I've learned to compensate for that, and it is something you can learn to compensate for. And a lot of that is we are treating some of my allergies with something, the Flonase, that helps with some of that, but it doesn't always take it completely away. So be aware of the thing with allergies, because it can really mess you up as far as, is this true hearing loss or is it not? Who knows? And I know eventually it probably will be. Causes of hearing loss. The most common one is loud noises. People who are around a lot of loud noises, such as people who are on gun ranges and don't wear protective hearing aids. They're not aids, I don't know what they are, mufflers, those kind of things. Snipers. Many of our snipers that were snipers of old did not have hearing protection for them. Many times nowadays you will see snipers with hearing protection for their ears when they're on the roofs to protect dignitaries, presidents, vice president, those kind of things. You may see that. So we've started realizing that that's an issue. Loud noises are the most common causes of hearing loss. I would imagine someone who's around loud music all the time too. So noise from lawnmowers, snowblowers, loud music can damage your inner ear and result in permanent hearing loss. I would imagine that a lot of gamers, because they wear headsets many times, are going to be found to have a lot of hearing loss. Loud noise also contributes to the tinnitus. You can prevent most noise-related hearing loss by turning down the sound on your devices, moving away from loud noises, or using earplugs or other ear protection. Earwax and fluid buildup can also cause hearing loss by blocking sounds that are carried from the eardrum to the inner ear. If wax blockage is a problem, your doctor may suggest mild treatments to soften earwax. There are a lot of treatments around, not only irrigating your ears every once in a while with warm water, and I wouldn't do hydrogen peroxide if you've ever heard that in your ears. It's a terrifying sound. A lot of people swear by ear candling. Use at your own risk. I don't know. I've never experienced it, so I don't know if it really works. There are also some things on over the counter that can help with that, like the Brox is one of the big ones to help with that. So a ruptured eardrum can also cause hearing loss. The eardrum can be damaged by infection, pressure, or putting objects in the ear, including cotton-tip swabs. There's a reason. Doctors would tell you cotton-tip swabs should never go into your ear. I worked with a nurse whose husband constantly had an ear swab in his ear and went out to the car one day, ear swab in the ear, car door slammed on him, ruptured his eardrum. He now has permanent loss in that ear. Just be careful with an ear cotton tip swab. You should also see your doctor if you have ear pain or fluid draining from your ear. Those are some simple things that you can do. Also, keep in mind health conditions such as diabetes or high blood pressure can contribute to hearing loss. Ear infections caused by viruses and bacteria, a heart condition, stroke, brain injury, or a tumor may also affect your hearing. Hearing loss can also result from taking certain medications. Believe it or not, those medications are usually used to treat serious infections, cancer, or heart disease. They also include some antibiotics and even aspirin at some doses. So if you've noticed a problem taking a medication, check with your doctor. Generic variations can also cause hearing loss. Not all inherited forms of hearing loss are evident at birth. My daughters were evident at birth. Some forms can show up later in life. The osteosclerosis, which is thought to be a hereditary disease, involves abnormal growth of bone that prevents structures within the ear from working properly. Hearing losses can affect your cognitive health. We have a greater risk of developing dementia than other older adults with normal hearing. Cognitive abilities, including memory and concentration, decline faster in older adults with hearing loss than with adults with normal hearing. Recent analysis of several studies found that people who used hearing restorative devices such as hearing aids or cochlear implants had a lower risk of long-term cognitive decline compared to people with uncorrected hearing loss. Also, if you can't hear well, you may become depressed or withdrawn from others because you feel frustrated or embarrassed about not understanding what is being said. And then sometimes we confuse those with people who are confused, unresponsive, or uncooperative. Hearing loss, even in small amounts, is also linked to an increased risk for falls, can affect public safety as personal safety, as the ability to drive safely when warning sounds are harder to hear. If you notice that you're having hearing loss, talk with your doctor. If you're having trouble hearing, you should let your friends and family know you have a hearing problem. Ask people to face you to speak louder or more clearly. Ask them to repeat themselves or reword what they are saying. Pay attention to what is being said and to facial expressions or gestures. Let the person talking know if you do not understand what was said. Find a good location to listen. Place yourself between the speaker and sources of noise and look for quieter places to talk. The most important thing is to seek out professional advice. Your doctor can diagnose and treat your hearing problem, and you may need to go to an ear, nose, and throat doctor or an audiologist. This is someone who can identify and measure hearing losses. Devices that help are hearing aids. These amplify sounds and help you communicate with others. There are also alert systems such as keyboards, touchscreens, text-to-text technology that can help you give and receive information more effectively. There are alert systems that work with doorbells, smoke detectors, and alarm clocks to send visual signals or vibrations. There are a range of these. There is a place called the National Institute on Deafness and Other Communication Disorders. Hearing aids are electronic battery run. You'll probably see an audiologist who will prescribe that aid for you. Prescription hearing aids require a medical exam, and then you also get fitted and adjusted for those. Hearing aids have recently become available without a prescription and over the counter. These are sold in stores and online, and they may help you with mild to moderate hearing loss. Before buying a hearing aid, find out if your health insurance will cover even a part of it or all of it. A cochlear implant is different type. This is for someone who has profound deafness or hard of hearing. These make the sound clearer so you can hear it, but it also creates electronic signals that the brain recognizes as sounds. This implant does require surgical placement and hearing therapy. Now, if you know someone who has hearing loss, how do you talk to them? Here are a couple of suggestions. In a group, make a point to include people with hearing loss in the conversation. Find a quiet place to talk to help reduce background noise, especially in restaurants and social gatherings. Stand in good lighting and use facial expressions or gestures to give clues. Face the person and speak clearly. Maintain eye contact. Speak a little louder than normal, but don't shout. Try to speak naturally and at a reasonable speed. Don't hide your mouth, eat, or chew gum while speaking. Repeat yourself if necessary, using different words. Try to make sure only one person talks at a time. Be patient. People with hearing loss may also be frustrated by their condition. Stay positive and relaxed. Ask how you can help. That's a big one. Ask how you can help. One of the other things is I know there are a lot of people that will learn sign language as it gets harder and harder for them to hear. Sign language can help you with a lot of things, so that's something you may consider doing. There are a lot of things online that you can learn sign language with, whether you're using ASL or BSL. There is a difference. Most people in America use ASL. Other countries, they may use BSL. There are some similarities, but not completely. I do know that there are some older people that learn to speak, that learn to read lips as they go. So there are a lot of things there. There are quite a few links here that I'm going to provide for you that can help as well, to give you suggestions or where to go to get help. So that is it for today's video. I hope it covered a few topics that can be helpful to you as you age, and if you're experiencing hearing loss at all. One of the ones that I do follow quite a bit is the American Tinnitus Association. Just helped me with some of the issues that I have as well. So consider it. it may be helpful to you. All right, guys. See you guys soon. Everybody have a great week. Stay hydrated. Stay active. Get out there and make connections with other people however you can. See you guys next week. Bye.